Pediatric sleep disordered breathing may have long-term consequences, and one of the most important ones is neurocognition. So these children, if they're having obstructive sleep apnea, and as a consequence, they may have hypoxia that's intermittent, and also changes in their diaphragmatic pressure. So these children may have obstructive sleep apnea and neurocognitive problems, and they may have low academic notes, and they may have failure in math, for example, and they have decreased quality of life. Not only children, but also their parents have decreased quality of life because they're concerned the kid is not sleeping well, and or maybe the kid has apneas. So it's a very important issue that sometimes as health professionals we forget, and that's another concern. And in adults, obstructive sleep apnea is associated with a lot of cardiac problems. Although kids may have high blood pressure and some cardiac functional and structural changes, we don't see it right away, but in the long term, we're always concerned if these are going to be the adults who may be at risk for increased risk for cardiac problems. So this is another concern, because we know these kids will grow up and they may be at increased risk because they've been exposed to obstructive sleep apnea for a long time. And another problem is that they may have failure to thrive, so they don't have good weight and height gain during their early years, which may also have long-lasting effects. The most important one in diagnosing obstructive sleep apnea in children as a challenge is that there's lack of resources for these kids. Having sufficient amounts of polysomnographies are not done in children. So there's a lack of resource in a lot of countries, even in developed countries. So these kids may be in waiting list for polysomnography for a year or two. And we have some screening tests. Some of them can be performed even in low resource settings, such as polygraphy or overnight oximetry, but still we lack a lot of standardization for these tests. So we can have these tests, but they cannot be maybe sometimes interpreted well, and they're not good guidelines. So we really need to sit down and think about this. And also another problem is that there's a discrepancy in with the results of polysomnography and the outcomes. So sometimes a kid may have the same severity of obstructive sleep apnea as the other kid, but he or she may be more prone to such side effects such as neurocognition, and we don't have a good way of telling which kid is going to have a long-term consequence. So that's another issue that we need to work on. Maybe stratify risks for children, not only using polysomnography, but maybe other biomarkers or other tests.